February 2009. America is deep in a financial crisis, and Congress passes one of the largest spending bills in its history. Buried inside it, the biggest upgrade to health privacy since HIPAA itself. Records go digital, breaches go public, and the maximum penalty grows from $25,000 a year to $1.5 million. This is the story of HITECH. Health tech frontier. Picture where the story stands. The privacy rule, enforceable since 2003. The security rule, since 2005. And yet most medical records still live on paper, and the penalty for breaking these rules still tops out at $100 a violation. 13 years after HIPAA, the framework is built. But adoption is slow, and the consequences are pocket change. The American Recovery and Reinvestment Act, the stimulus, is signed February 17, 2009. Tucked inside is the Health Information Technology for Economic and Clinical Health Act. HITECH. It makes the government's health IT office permanent, and it makes a bet. If America won't digitize medicine on its own, Medicare and Medicaid will pay doctors and hospitals to do it. But the money came with a catch. The two words every doctor learned by heart. Meaningful use. You didn't get paid for buying a computer. You got paid for using certified electronic records meaningfully, prescribing electronically, exchanging information with other providers, reporting quality measures. Adoption took off, and the paper chart began to die. Then HITECH turned to what happens when data leaks. Before 2009, a breach could stay quiet. Now, if your records leak, you must be told. Within 60 days of discovery. If more than 500 residents of a state are hit, the media gets notified, and breaches affecting 500 or more people go to HHS and onto a public federal website anyone can read. Sunlight became policy. Next, the vendors. Billing companies, IT firms, cloud services, the businesses handling health data for providers had lived one step removed from the rules, bound only by contracts. HITECH ended that. Business associates became directly liable under the security and privacy provisions themselves. Touch health data? Carry the responsibility. No more hiding behind paperwork. And the teeth. The one-size penalty became 4 tiers, scaled to culpability. Didn't know and couldn't have, from $100 a violation. Reasonable cause, from $1,000. Willful neglect, corrected, from $10,000. Willful neglect, uncorrected, $50,000 per violation, with the yearly cap raised to $1.5 million. And for willful neglect, penalties stopped being optional. Investigation required, penalty required. Ignoring the rules became the most expensive choice in healthcare compliance. HITECH also multiplied the enforcers. State attorneys general gained the power to sue on behalf of their residents. HHS was ordered to run periodic audits, not just wait for complaints. And in a quietly brilliant move, the penalty money collected flows back to the enforcement office to fund more enforcement. The watchdog now feeds itself. Records digital, breaches public, vendors accountable, penalties real. In 4 years, HITECH did more to change health data in practice than the previous 13. But it left the rulebook scattered. New requirements layered in interim regulations across the old rules. Someone had to pull it all into one document. In 2013, someone did. That's the next full story, the Omnibus Rule. Subscribe so you don't miss it. This has been Health Tech Frontier. Subscribe for the next chapter.